Right, you're watching TVC Breakfast. The Nigerian Center for Disease Control says since the onset of the 2019 Lassa fever outbreak, the country has recorded 83 deaths in confirmed cases, with some 381 people confirmed positive with Lassa fever as at February 24. But Director General NCDC Chikwe Hekwazo says compared to last year's outbreak, there has been a steady decline in the number of cases. In the meantime, Ondo State, one of the states with high rate of cases, says it spends about 1.6 million naira to treat each patient affected with Lassa fever in the state. A total of 115 persons were infected with the disease in the state between January and February 2019, with about 21 persons dead. All right, a consultant public health physician, Dr. Kemi Odukoya, joins me now from Lagos via Skype. Dr. Odukoya, it's good to have you join me this morning on Skype. Now, make us understand, it seems the idea or how to totally eradicate Lassa fever permanently has eluded Nigeria, because every year this keeps coming. What's the big challenge?
Yes, that's the challenge we have. Thank you. Well, Lassa fever is a challenge because it's a viral disease. It's a disease that has the potential to spread, and it's a disease that is ours. And what do I mean by it's ours? It's a disease that was founded in Nigeria. It's named after a village in Nigeria. So it's very, very prevalent in this environment. It can be curtailed. And the reason why we haven't curtailed it yet is because we haven't done the things that we should be doing. And what are those things? They're simple. The first thing is, just like we're doing today, people need to be educated. What is Lassa fever? It's caused by virus. However, where is that virus found? It's found in rats. Not just any rat, there's a specific kind of rat. Now, as you would imagine, and we have done some studies, many, particularly in densely populated areas, many homes are infested with rats. So good hygiene is the first and probably the most practical way of dealing with Lassa fever. If we can get rid of the rats, that's the first and the most effective thing that we need to do. How do people get infected with Lassa fever? Well, first of all, the rats have to be in close contact with human beings, and that's why if we don't have rats in the homes, we wouldn't have outbreaks of Lassa fever. But that's just the first step, because the rats contaminate food either through their feces or their urine or their saliva. So when people come in contact with those contaminated items, they are more likely to be infected. All right,
Dr. Odukoya, we know that there are people who eat rats. What kind of risks are they exposed to?
Yeah, great question. Yes. Now, Lassa fever, because it's a virus, it can also be it can also be transmitted by inhalation of the aerosol virus. What do I mean? People who prepare bushmeat, well, it would be called bushmeat, but this is when they are preparing infected rats, either as delicacies or whatever. If those rats are infected, the virus can enter the air, and when people are preparing them, they could inhale them and they could get infected. And when those people are infected, they are very contagious. So it's not just for them, the people around them as well, and also the healthcare workers that take care of them. All right, now we have case.
What is the big challenge? Why it is not identified on time, and then it leads to the number of deaths toll? We're talking about 83 deaths so far. Why is it so challenging to identify it on time?
Yeah, our biggest challenge is that Lassa fever has pretty much non-specific signs. What do I mean? It just looks like malaria. What are the signs, the early signs of Lassa fever? The patient has a fever. Malaria also presents that way. The patient feels weak. Malaria also presents that way. The patient has a bit of a sore throat and a cough. So the fact that Lassa fever doesn't have any easily distinguishing signs is a big problem, because the people at home, when Lassa fever starts, it's difficult for them to know that, hey, this is Lassa fever I'm dealing with, and not just any other illness, not just malaria or not just stress, like many Nigerians would call it. So the fact that it's difficult to diagnose or identify early, both in the community and in the healthcare centers, is also very important. Then, Lassa fever is treatable, but there's a caveat there. It's treatable when people get to the hospital early. But many times, as you would imagine in this country, when someone has a headache or a fever or something like that, there would be, many other levels of care. And then when it becomes really severe, that's when they do get into the hospital. So we do have a challenge with early diagnosis and treatment.
The incubation period between when one contacts it and when it manifests, and even to the level of death.
Yeah. Now, when somebody comes in contact with Lassa fever, usually within 3 to 5 days, the person will start to develop symptoms up until a maximum of about 21 days. So when we watch people, we call that contact tracing. When we watch people who have come in contact with those who have Lassa fever, usually we watch them for about 21 days. And if they're fine after 21 days, then we know that they're good. But people who have come in contact with Lassa fever need to be observed for at least 21 days.
To leave you here now, Dr. Kemi Odukoya, consultant physician, thank you so much for talking to us this morning.